have a husband, a brother, father, or significant man in your life between the ages of 45 and 69, please listen up. Prostate cancer is the most common cancer among men in New York State, especially if you're African American.
That's right. So let's talk about the numbers, right? They don't lie here. Researchers say about 1 in 7 men will develop prostate cancer during his life. Each year, nearly 15,500 men in New York diagnosed with prostate cancer, and 1,700 men die of the disease each year. Among black men, that number is double. And this issue certainly hits close to home right here on Pix 11 with our morning news family. Our very own Craig Treadway was diagnosed with prostate cancer in 2014, underwent a successful surgery. Early detection can certainly be a lifesaver, like it was for Craig. He talks about it often. Joining us this morning to discuss how the New York State Health Department is helping men beat the disease is Acting Executive Deputy Health Commissioner Johanny Moore. So good morning to you, Commissioner. Thank you so much for being here this morning.
Well, thank you, and thanks for the opportunity to have this important discussion.
Absolutely, such an important discussion. So let me begin first and foremost, right? Warning signs and symptoms. We hear about that all the time. But what are they when it comes to prostate cancer, and how is it detected?
Sure. Well, the first thing that's really important and very simple, just, listen to your body. Some of the symptoms that people talk about are excessive need to urinate. Some individuals have issues with their bowels. Other people have some physical issues that they have never experienced before. And if you're feeling like you just don't seem like yourself, you should be talking to the doctor, whether it's about prostate cancer or anything else that may be happening for you.
Yeah, and when they go in for these exams and testing, can you help us kind of explain the language that use, like, what is a PSA level, and do the average levels change as men get older?
So the levels can change, during different times, and there are screenings that a physician will do with you in order to look at certain sets of numbers and to determine whether or not numbers are high. When numbers are high, of course, that indicates that there's an opportunity here for us to do a bit more testing to determine exactly what may be happening.
So, here's the thing. Men, we don't want to go for screenings. We sometimes, we got to be pushed to go, and early detection is so key in moments like this, right? So at what age should men begin getting prostate screenings, and then how often?
Sure. We look at between 50 and 55 to start getting those screenings. What's really important, and sometimes if we don't feel something, if we don't have a symptom, we tend to not think that we need to go. But as you said earlier in this segment, early detection is what's key and what's going to allow for the number one, the early onset for treatment, and then number two, the best outcomes, right? Speaking with your doctor, looking at things like family history or other health issues that may contribute to greater risk is really important to determine how often you should be screened.
Right.
But certainly looking at some of the recommendations of 50 to 55 as a start. Also, you should know, and it's interesting, but again, this is a discussion with yourself and your physician. Individuals over the age of 70 often are not sent for this screening, and the reason for that is because it's determined that some of the outcomes of screening may in fact be less helpful than the actual treatment.
Well, we had mentioned earlier too that black men are at higher risk of being diagnosed with prostate cancer and also dying from the disease. Why is that?
Yeah. So, it goes back to our conversation right now, looking at opportunities of really taking steps for prevention, looking at opportunities to go to your physician, having early treatment. And, in general, for most of us, again, we don't necessarily think about going unless we have a symptom, right? But let's just talk in general. When we talk about most health issues, if not all health issues, we see disparities when it comes to Black and Hispanic individuals. And in this situation specific to prostate cancer, this is no different. So number one, being aware and having the education and outreach to know that the screening is significant. And then number two, actually taking the steps to go to your physician and have these conversations so that you can be screened.
Yeah, I mean, getting there, and that could be said for so many things, not just prostate cancer when it comes to these things. It's going to have those conversations with the doctor overall, which can be tough, especially for men who don't want to admit that maybe something is wrong. So what are some things that, besides, obviously going to the doctor, Is there anything we could do as men to reduce the risk of developing prostate cancer? Eating a certain kind of food, exercise, sleep, whatever it may be.
Yeah, I mean, certainly when we talk about health and wellness, any of the activities you just named, making sure that, we are thinking about our diet, we are thinking about our physical health, as well as our emotional and mental health. Stress plays a significant part in some of the issues and health issues that we see happen to our bodies. I think what's really important, and we talk about this with so many health issues and so many life issues, is just making it common to have these conversations.
Yeah.
Oftentimes we don't talk about cancer, right? And we don't necessarily talk about the risk or encourage one another to go and get screenings, and looking to the people that we love and looking to the people that most often are our support systems is really important to make these conversations more normalized, and making sure that regardless of symptoms that you go at least and have an annual physical every single year.
Yeah, which is, and that's something you should also talk to your friends and loved ones about, other men in your family, other men in your life. Hey, I'm going, you got to go too. Let's all go and talk about it and have these conversations.
Absolutely.
All right. Yeah. All right.
That's absolutely right.
Commissioner Moran, thank you so much for being with us this morning and talking about this very important topic.